when faced with novel infectious diseases such as COVID-19, the first responders by learning by doing has to become a teacher of the people and the countries that follow. So the lessons and the experiences are hard-won with many sacrifices made by the tens of thousands of healthcare workers on the front line and people who live through the community quarantine and other measures. Of course, I would be the first one to object the wholesale adoption of successful models or experiences that worked in one country to another country. The adoption process would have to be embedded naturally in the economic, social, cultural context of a particular country. But I think we are all in this business basically to bind the two curves. Number one, we have to make the learning curve as steep as possible. And second, we have to make the epidemic curve as flat as possible. Mm-hmm. And the successful measures, in summary, are two C's. One is to decreasing human-to-human contacts, and the second is to increasing capacity. Now, the successful experience in China, in South Korea, all did a very good job in case finding and tracing of close contacts, either then followed by self-quarantine or community quarantine. Now, capacity building and surging is also a very critical second step. Now, I don't care if you build, you turn the stadium into a big temporary hospitals, or you make tent hospitals or medical ships, but surging, increasing the medical capacity is a very critical state. Of course, medical waste management and other measures need to be also taken into account. So the capacity increasing is not only about treatment, diagnostic and treatment, but also about public health capacities. In Wuhan, for example, one fact that often got overlooked is we gathered together more than 1,800 epidemiological teams with at least 5 members per team, whose job is to sort out tens of thousands close contacts and infectors per day. And that really helped bend the epidemiological curve and bring the crisis under control.
But the problem is, has the U.S. learned what China did? The U.S. has now confirmed over 26,000 cases, and that number is still growing at fast rate. What do you make of the numbers?
Unfortunately not. I think United States will be the last one to face this kind of the dire situation. You know, the most developed country and the most technologically advanced country. And I remember vividly, as early as in mid-January, I called again a 4 press conference, very impressive. The Secretary of Department of Health and Human Services, NIH and CDC leaders, you know, faced the press and told the world, you know, how the United States should get ready and get prepared. You know, some of my family members and many of my former colleagues and friends live in and work in the States. So I'm concerned about them, and they're constantly complaining of how vastly underprepared the whole country was. And of course, this is largely due to the screw up by the president. You know, President Trump, this is the same person who said, you know, earlier, don't worry, you know, nothing to worry about, and this coronavirus will go away like magic in April. And now I think he was a little bit chaotic, but, you know, it's never too late to take action. And I would not have expected that even the teaching hospitals of Harvard University would have a shortage of protective gears for their frontline healthcare workers. You know, they are calling out for help. Actually, last month, I heard some of the scientists signed a petition to call on the president to take urgent action, which he hesitated to take. Now, till the last minute.
Well, it is indeed the time for the U.S. to catch up. Thank you very much, Mr. Liu.